All right, good afternoon, everyone. Sorry, I forgot to press live session. So, can you hear me now? Can you see me now? Okay, still waiting for your response. Can you see me? Can you hear me? All right, very good. Okay, so again, a very good afternoon to all of you. And it's not late for me to again wish all of you who are celebrating Selamat Hari Raya. And today is day 5 of Hari Raya. So jangan sedih-sedih. We'd like us to go on, even though you're at perantauan, we can still celebrate. And those of you who are from home, okay, stay put where you are. Okay, and let's begin with an opening prayer. Okay, a moment of silence, everyone. Okay. Okay, all right. Okay, I'm actually excited to use my new camera. That's why I actually forget to press the go live. So sorry about the earlier technical problem. So now you can actually hear my voice. Is that clear? Is my voice clear? And you can see my small cute face there. Okay, and the slide as well. Okay, can you hear me? Is that clear? Is the sound clear? Sound check 1, 2, 3. 1, 2, 3. Very good. Thank you very much for responding. Okay, so this afternoon we will continue with our topic. There are three more topics actually. Hopefully, I can finish two topics for today. So let's begin without further ado. Okay, I hope all of you are ready. Actually, I want to finish it fast. Probably might be delayed a little bit later on in order to actually cover all the topics, the two topics. Okay, and it's going to rain soon, so hopefully the line is actually helping us as well. Now the notes actually already uploaded earlier on. All notes for annual R154 is already uploaded in the Google Classroom, so please have a look. Okay, thank you, Wani. I was about to ask as well, who is again sharing the laptop. Okay, so I supposed to have 29 and 7 more students. Siapa yang share, tolong inform as well. Who are sharing, please inform, yeah? Alright, and I have actually put also some announcement in the Telegram, especially on your tests, upcoming tests. So sekarang season test lah, okay, season test. So I hope you actually do well in your test. Jangan just sekadar lulus, but score better. Okay, score better. And we will actually start our presentation this Thursday. Okay, this Thursday with the first 4 groups on NUR 154. Okay, right. For those yang lambat hantar, okay, lambat hantar, you just present whatever it is, so you will get your marks as it is lah. Especially the antihypertensive group yang satu group pun belum hantar lagi. Okay, alright. So let's proceed with our first topic of the day. We will talk about complementary and alternative medicine, or we call it CNM. Now, complementary and alternative medicine is actually nothing to do with the drugs. So it is a therapy that helps in healing as well. So you can actually see what it is all about later on. All right. So the learning objective for today's topic is that you should be able to define what is CAM, complementary and alternative medicine, and then list the types of the CAM and discuss the nursing implications of CAM. You might have heard about this. You are also practicing about this. And the good news is that in SGH, Sarawak General Hospital, we have a center that actually practice CAM, but not all. not all. Okay, so we will see later on what are things that is being practiced in Sarawak General Hospital, and the things that you might actually do it on your own or with your family, and you just know that it is it's the complementary and alternative medicine. All right. So when we talk about alternative therapies is to be something out of the drugs, the mainstream of the healthcare, considered to be outside, yeah. And the common characteristic are, of course, to focus on treating each person as individual. After that, we consider the health of the whole person from head to toe, and we talk about integration. We talk about how to merge our mind and body together in helping in the healing, promotion of disease prevention, self-care, and self-healing. And lastly, recognition of the role of spirituality in health and healing. So when we talk about spirituality, we talk about things that people believe. It can be religion, it can be religion kind of thing. So spirituality is not necessary to be having religion, but it's also something to do like the beliefs that the person has. Okay, now CM is a very good topic to be done in research as a research thing, because there are lacking of rigorous research, though underway for many therapies, and they seek effectiveness or sometimes lack of effectiveness. Maksudnya, certain terapi yang diperkenalkan that has been introduced might not have bukti sahih or scientific findings saying that this thing is working 100% and really can help. So that's why research has to be done in order to find the effectiveness, to look into the topic now and then, so that people will have more alternative, not to depend just on the drugs, but the things that is beyond drugs that can also help them in healing. All right. So we have a few types of CM, complementary and alternative medicine. So we have ingested therapies, okay, benda yang dimakan, terapi yang dimakan. Now this is again not the drugs, but it's like supplement, okay, it's like the herbs kind of thing. So those therapy that is actually ingested. And then we can have alternate healthcare systems. We will look into detail what are those. Manual healing, mind-body interventions, spiritual, and any other therapies. Okay, so ingested therapies, as I have told you, besides the one in the picture, which is all the pills, but it can be also pills, but that pills is not drugs. It is actually herbal therapies, nutritional supplements, and also special diets like keto diet, Mediterranean diet that is actually good for your health. So these are also known to have, helping. I'm sure we talk about things that are being promoted online. Okay, they said this, this. Okay, but they cannot overclaim. They cannot overclaim. You remember I told you there are 21 penyakit, okay, diseases that is supposed not to be overclaimed. Okay, all right, because scientifically there's no cure for it. For example, cancer. Okay, and if you are saying that the things that you ingested here can cure cancer, then there will not be people who are dying. Okay, so some of the things we can say membantu mengurangkan, membantu mengawal, but bukan menyembuhkan 100%. That is overclaim. Alright. So the therapeutic natural products, we have talked about this, the origin of the drugs. Remember we talked about the plants earlier on. Okay, so especially Chinese, they are still practicing and actually still taking it, herbal medicine, which has been used since 1,000 years ago. And the earliest recorded of the uses of plant is garlic, bawang putih. Bawang putih ni banyak khasiatnya, tapi kita ni tak suka bawang putih. Saya lah, right? It was in 3000 before Christ, that is sebelum Masihi. Aston Eastern and Western medicine have recorded thousands of herbs and herbs combinations. We have therapeutic values. So with all the GG here, garlic, ginger, ginkgo, ginseng, jalvani, tiba-tiba jalvani. Okay, because G kan, right? Garlic, ginger, ginkgo, ginseng are all very good to health lah. They actually contribute to some nutrients to actually help in making a person well. Okay, right? And they can be in a raw form or it can be formulated in such a way that it is edible, okay, such as solid or liquid. So if it is solid, it can be in the form of pills, tablets, capsules, okay, it can be in ointments form, liquid, okay, ubat sapu, right? So we have many types on all those things that we use, which is not like taking the medication, is actually CAM, okay, complementary and alternative medicine. And I actually personally prefer CAM over drugs unless the CAM fails to help me, then I will sort to medication. Contohnya macam pening kepala kan. Ada orang senang kalau pening kepala makanlah Panadol. But then before you think of before you think of taking the medication, so what happened? We try to rest, letak ubat sapu kat kepala, koyok kat kepala, something that is actually applied topically, and then put the Vicks on your nose or anything, balsam, minyak kapak, whatever it is, trying to not to actually think of the headache and have a rest definitely. Okay, right? So that is one way of the therapeutic natural products. Okay, and then these are what we see Malaysian herbs. Siapa kat sini suka makan ulam-ulaman? Ulam-ulaman ni best tau. Dengan tumbuk belacan dia, cili sikit, ikan bilisnya. Teringin pula. Nantilah mak tumbuk belacan ni lepas ni. Okay. So these are the things that you can actually find in the kitchen as well. Okay, ni jantung pisang. Okay, jantung pisang. Sedap tau masak apa tu stir fried dah jantung pisang. Ulam raja dia macam ulam-ulaman tapi these all things are actually Malaysian herbs and it's actually very common in the kitchen and it is actually easy to find. Okay, and then kacang botol is kacang bintang. Ada kelisa pula, aku ingat proton kelisa. Okay, kacang botol is kacang bintang. Okay, when you actually cut it, it has like 5 bucu, that is kacang botol. Okay, then you have timun jepun. Timun jepun and normal timun is slightly different. Timun biasa is actually bigger. Timun jepun ni hijau je, kurus je dia. Okay, and it's actually has nature sweetener. Madam suka timun jepun. Senang je, you kopek, you terus makan macam you makan debu, something like that. Okay, siapa geng petai? Petai ni bagus, bau tapi sedap dan ada khasiatnya. Okay, petai nak masak apa? Ada yang makan mentah, ada yang masak dengan tempoyak, ada dengan sambal udang, sedapnya. Okay, mesti korang pun terbayang-bayangkan kalau your parents, your mom cook that in the kitchen, okay, sampai merusuk. Lepas tu 3 hari lah bau tahi, bau kencing, bau nafas, okay, right? Tahi dengan kencing tu there's no choice. It has to come out but it takes time, about 3 days most lah. Okay, kalau untuk mulut, petua dia bila dah makan petai, you kunyah beras. Like kalau dia ikutkan segenggam, tapi kalau you tak dapat nak genggam segenggam, tak dapat kunyah segenggam beras, then you eat bit by bit. Okay, mula tu memang tak biasa tapi lama-lama okay. The beras yang belum masak, beras that is to actually like a natural cleanser and also rinse. That can rinse in your mouth. Okay, right? Pegaga, daun pegaga. Okay, we have few that is almost the same of shape. We have daun pegaga, we have daun soup, we have daun. There's one more. I can't remember. Kalau pergi market ni, nak tahu beza dia, dia punya smell. Of course, definitely the smell. If you are not sure, you can always ask the makcik yang menjual, kakak kat jual kat pasar tu, tanya, ini daun apa? Ada yang bagus lah, dia label ni daun pegaga, daun kesum, that's the word, daun kesum, and then daun soup. It's almost the same, but the thing that differentiate the three of them is the smell. Kalau pernah cium bau bau apa nama tu, bau daun sup, dia wangi lagi. Kalau bau daun kesum, dia bau macam bau insect. Kalau tak silap lah, correct me if I'm wrong, ya. Okay, alright. And then we have bandy. Okay, Pramli cakap bandy. Okay, kacang bendi lah, kacang bendi. Okay, bandy rebus. Rebus is the best. Okay, or in scientific name is called okra. O-K-R-A, okra. My favorite as well, bendi rebus. Tadi kacang botol tu kalau rebus pun, I will not say rebus. Bendi dengan kacang botol, you celur. Celur ni tak lama. You just nak make sure dia masak sikit lah, tak terlampau masak. Then you pergi celup dekat sambal belacan. Marvelous. Okay, alright. Pucuk ubi, I'm sure all of you know that. Okay, here in Sarawak, we call ubi as bandung. Kalau orang cakap pucuk bandung, ubi is bandung lah. So pucuk bandung or pucuk ubi, and definitely you know that. And you know that pucuk ubi, especially daun ubi itself, has high concentration of iodine. And bila cuci dia kena cuci betul-betul dengan garam. Garam bertindak sebagai neutralizer to actually get rid of excess of iodine. Itu petua dia. Ini petua ni daripada how to say, medium lah, bagi tahu korang ya. Kalau nak jenis pucuk ubi tu supaya dia tak concentration of the iodine not too high, you actually gosok dia dengan garam. After that you kena cuci. Okay, after that you kena rebus sikit. Then you can actually take it. Alright. Terong pipit is the I'm not so sure whether you can see this in the picture. Ada terong pipit ni, dia terong bulat, tapi pipit. Kenapa pipit? Kecil je. Okay, yang ni pun sesuai dimasak dengan daun ubi. Tumbuk dia, pecahkan dia. After that, goreng dengan ikan bilis, bawang putih dengan daun ubi yang telah tumbuk. Sedap. Kalau you tahu makan ni, memang marvelous lah. You tambah nasi tau, tambah. Okay, so that is terong pipit. Terong pipit is the small there. Sayur, kebanyakan sayur ni Malaysian herbs actually. And last but not least, of course, what is stated here, but there are more. Peria katak. Okay, peria katak, it looks like peria, smaller. And kenapa dia katak? Sebab katak odor. Katak ni sebenarnya, for me, katak cantik, kodok yang odor. Kodok ni dia punya kulit ada berkerutu sikit, ada tak licin lah. So jadi kalau peria katak ni, dia kecil and then dia berketul-ketul. Tepi-tepi dia betul. Kalau peria biasa, dia cantik je. Panjang je, cantik, licin je dia punya kulit. But if it's peria katak, there is like ada macam ketumbuhan, tapi sebenarnya tak. That differentiate peria katak and also peria biasa. And peria katak is actually very good in helping when I said in helping to reduce blood sugar. Blood sugar memang pahit lah. Memang pahit. So kalau you cannot take, for example, if your family members are having diabetic, cannot take that peria katak as macam you potong dia masak jus dia. There are found in supplements and even in a sachet. Dah di blend everything. Lepas tu kira bancuh and then minum. Okay, sedikit pahit lah kalau macam tu. Pernah cuba. So that's why I'm actually there. I dare to actually tell you how does it feel and how it is there, yeah. So you have what else which is not inside the list? You have basil, daun basil. I'm not so sure in bahasa we call it daun apa. Ginger is halia. Lemongrass is serai. Then you have your coriander. Coriander, I think is that, was it daun kesum just now? Or was it pegaga? Okay. We have onion. And then we have bunga kantan. Okay. Torch ginger namanya dalam bahasa Inggeris. Kalau bahasa Melayu Sarawak or Iban, bunga kecala. Kecala. Tamarind is asam jawa. Okay, asam jawa. Then have chilies. Okay, coriander is not pegaga. I think it's sangkosong, if I'm not mistaken. Okay, or I might be wrong as well. Pegaga, garlic, and then we have the kaffir lime. This kaffir lime dia limau apa sebenarnya? Limau purut. Kaffir lime. Okay, limau purut. Macam-macam lah limau yang ada. They are also very good in a way to can help in your health as well. So basically, if you are vegetable lover, you are not far from this. Okay, so basically you can eat almost all the Malaysian herbs. That's why you can still okay lah kayu. Selalunya orang start sakit ni bila dia kurang makan sayur. Kau rasa siapa kurang makan sayur kat sini? Angkat, cuba tengok, cuba. Saya tidak cetak, saya just angkat tangan saja. But I love all these things here, especially ulam-ulaman. Alright. Okay. What else we can see here? We have cucumber. I think the yellow one should be pineapple. Okay. And then we have long beans. I think in front here, macam daun getah juga. Daun getah is actually good for fermentation. Kalau nak mengawet daging, daun getah is actually very good. Okay, right? This is again diabetes herbal remedies. You have aloe vera. Okay, this is what I call Priya kata just now. Bitter melon. It's not bitter melon. I think spelling is wrong there. Bitter melon. Okay, berkerutu je, tak cantik, hodoh, tapi dia memang powerful to help to reduce blood sugar. Okay, and then you have cinnamon. Cinnamon is kayu manis. Okay, fenugreek. Fenugreek tak tahu apa benda tu. Okay, and then we have Gynema sylvester. Mungkin nama betul tak sure. Ginseng, Coconia grandis. Okay, sejenis timun juga sebenarnya. And then we have Salacia oblonga. These are all the scientific name, of course. You can actually Google later to see what it is, the terms. You might know it, you might take it, but you don't know the scientific name. So you can actually have a look later on. Right, so that is ingested therapies. Okay, any questions so far? Any questions so far? Okay, do you have any questions so far? Okay. Ada budu sedapnya. Right. Oh ya kah? Stuck eh? Right. Okay. I think the line is not helping. Muka dia stuck. Okay, tengok lah. Okay. Okay, hold on. Let me just try another one. Camera. I think line is not actually helping much.
Okay, mute. Okay, right. Can you hear me now? Okay, can you hear me now? Thank you very much, Wani, for actually telling me. I think now have sound. Sorry, I actually accidentally pressed the mute button. Can you hear me now? Can you hear me? Okay, very good. Okay, let me continue, yeah? Okay. All right. Next is, oh, sorry. Okay, next is we talk about alternate healthcare system. So we have many types of therapy. Okay, we have natural therapy, homeopathy, chiropractic. Okay, chiropractic yang macam yang tekan-tekan tu, it's not whether it's tulang or again more the muscle, I guess. Chiropractic, never tried that. Okay, chiropractic, and it has to be done by a professional and also a trained was it chiropractor? Can't remember. Okay, homeopathy is using herbs, definitely. Okay, for example, here we have Native American medicine, where they use sweat lodges, medicine wheels. Chinese traditional medicines, I'm sure you know what is acupuncture, okay, yang guna jarum tu, okay, and also Chinese herbals. Okay, homeopathy is a medical system based on the belief that the body can cure itself. Those who practice it will use tiny amounts of natural substances such as plants and minerals. So homeopathy ni lebih kepada tenaga dalaman. Ada juga homeopathy ni kalau pernah dengar or you have actually experienced that. So homeopathy is also very popular, homeopathy. So they just use sikit saja minyak and then the rest let the body heal. Either they do massaging, okay, right? Now, chiropractic is a form of alternative medicine, mostly concerned with the diagnosis and treatment of mechanical disorder of the musculoskeletal system, especially the spine, tulang belakang, especially tulang belakang. So, dia akan bunyi tak, 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 most of the time lah. Yang ni kena buat betul-betul. Takut salah, patah. Aku pula gilu. Alright. Acupuncture, okay. Of course, acupuncture is not as bad as this. This is just my slide showing you that there are needles on the face. Okay, it's a form of alternative medicine in which thin needles, it's thin needles. Ini nampak besar ni, macam paku, bukannya needles. It involves the insertion of very thin needles through your skin at a strategic points off on your body. So those who are actually very trained in acupuncture, they know where to actually pop the fine needles. Okay, and we have few centers in Kuching that has acupuncture center as well. Okay, right? So these are the list of acupuncture points. Kalau you berminat, you nak belajar, okay, you can have like a class or probably attend training and see apa tu. Don't ask me what is that because it's actually like Chinese word there. But I just want to show you where are the things, the point, the very important point where the needle is actually poked inside. Okay, like the story lift up your name, that itself movie Korea tu ada I mean the K-drama ada bercakap tentang acupuncture because the timur meets the barat, the west meets the east lah. Okay, so you can actually have a look. So it's actually quite interesting if you know how to do acupuncture points. Okay, now acupuncture points is where you use needle. There is another word, acupressure. So what happened? Acupressure is you main tekanan. So what happened? You tekan di tempat yang sama. The points where this acupuncture supposed to be there, but you gunakan your punya pressure, your thumb ke. So selalunya kalau orang yang pandai mengurut ni, dia betul-betul tekan di tempat yang sakit. So for example, your your feet, your toe, kalau tekan kat situ, it's actually helping to alleviate the pain that is surrounding your eyes and your head, kepala. Sesiapa yang pernah pergi reflexology, you can ask them, or you can actually have the experience and ask them what do they mean, because dia bila dia urut, dia urut betul-betul ikut garis, ikut point. Because why? That is where they will tell you it is painful. When you say pain, then they know something is not right in your body. That is very interesting, correct? Okay, all right. So here, when we talk about acupuncture, that was alternative. Now we go with the manual healing. Manual healing, we talk about massage, pressure point therapist, which is acupressure just now, and hand medicated biofield therapies. Kalau tak geli untuk dimassage, massage is wonderful. Because remember, if you have watched the video on hormone the other day that I gave you, okay, kalau you dah tengok, you will know that by through massaging, it helps to release some of the happy hormones in your body that makes you calm, that makes you feel better because dia buka lah ruang-ruang yang sepatutnya. Okay, right? So this is what I tell you just now. Some people believe that by applying pressure to our body's pressure point, it can help relieve pain, establish balance, and improve health throughout the body. So you can see that. Can you see here? Atas ni, kalau dia picit-picit dekat atas ni means what? Okay, tengok mata ini dekat otak. So kalau sakit kepala lah dekat toe. Okay, after that the eyes will be the second and third toe. Your ear will be the third and the fourth toe. Okay, going down, you can see kalau bawah-bawah lagi ada masalah dengan apa nama tu, you punya apa tu, reproductive system, insomnia point, and then tengah-tengah you have, if you feel pain, there means there is problem with your gastrointestinal, okay, and then you have your stomach at the tepi-tepi, okay, apa lagi, this is actually quite interesting. So bila orang mengurut, dia patut tahu dia bukan saja-saja urut, dia kena urut dan target the point. For example here, hypertension point. Kawak pun boleh urut dengan tekan sendiri. Pun boleh. Okay. So now you have this guideline. Probably you can have try. Okay. Tapi it might be very difficult when you actually massage your kaki. It has to be someone else. But you can actually massage your hand. So some part of your hand and your upper part of your body can be applied pressure. Yang tu senang sikit. Yang tu senang. Okay. Right? You can actually have baca lah tentang benda ni, which is actually, it might be helpful kalau patient awak complain pain kan. Probably instead of just giving the medication, if allow, pergi tekan sikit, massaging. Well, massaging is actually encouraged in the nursing, as part of nursing care. Okay, massaging is encouraged in nursing care, right? So that is manual healing. Next, okay, mind-body intervention. So when you talk about mind and body, you talk about your mind and your body that works together. So the two of them has to be integrated. So what are the things that we are actually talking about? Mind-body interventions, you have yoga, meditation, hypnotherapy. Yeah, I promise you hypnotherapy, hypnosis in the class, but we have not been to the class yet. Okay, so hopefully soon. We're still waiting for the green light from the rector to actually allow us to continue our face-to-face class. Supposed to be by today, all right? So let's wait and pray, hope, and see that we can actually go back to the class again. And then we have guided imagery. Guided imagery ni orang cakap bila you're in pain, tolong bayangkan ni. So you don't focus on the pain. So while you focus on the imagery, the procedure has been done, so you will not feel pain. So that is guided imagery. Biofeedback. Biofeedback itself is actually using, I would say they use some electrodes to actually see which part of your trigger, which part of the memory that makes you feel pain or what, and then trying to actually change that into another situation, which is actually coming. For example, for those who have undergone war, okay, trauma, PTSD, post-traumatic syndrome, okay, stress disorder. So they will use biofeedback most of the time to actually change that memory, bad memory, into something that is actually calming and actually calming and not stressful for the person. And we do have movement-oriented therapies, and this one, most of you may do this. You like to do TikTok, okay? You can do music and dance. So, ya lah, daripada kita tak fikirkan kita punya sakit, we do our music and dance. So, some of us, when we want to distress, we do that, music and dance, okay? That is mind-body intervention. So, as you can see here, yoga, the bigger picture, is a group of physical, mental, and spiritual practices or disciplines which originated in ancient India. Of course, yoga is one. For those who are very flexible, the body are flexible, so you can do yoga. But then if you don't, if you see all people kalau dulu-dulu lah masa sebelum COVID, you can see all people pakai baju putih, they will do qigong. Okay, qigong, Q-I, Q-I, was it K-O-N-G or G-O-N-G? Huh? And then we have meditation on the right side of the picture, small one. So people will find ways to actually do all those things, not to think about their disease and also pain. These are the ways that you can do things that you can suggest your patients can do or do together with your patient. All right. Tai Chi, Qigong. Okay, Tai Chi and Qigong is more gentle, softer, and it's actually very good for all people because why? They are talking about the balance. Biar the balance. Okay, right? Okay, next one, spiritual. Now we talk about spiritual, we always talk about religion, shamans, faith, and prayer. Some people believe that there will be miracles. In that way, we have to respect. We do have to respect. Okay, right? Example that is this one is very clear cut. Shamans, faith, and prayer. So what we can do is that examples, prayer, meditation, massage, and yoga have been used to treat both body and mind. Can reduce the need for medication, does leads to less adverse effects. Definitely kalau kurang makan ubat tu kuranglah dia punya adverse effects. So therefore we as nurses, we should be sensitive to the patient's need for alternative treatment and not be judgmental. Explain the advantages and limitations to the patients so they can make rational and informed decisions on their treatment. Okay, itu pentingnya kita tahu pelbagai jenis terapi so that when your patient tells you this, you tak terus, oh tak boleh lah, tak boleh. You don't judge immediately. Perhaps you hear and then you probably can learn from that. That is actually very good. So for example here, cara solat pesakit, solat cara duduk, and then now here, of course not only for the Muslim to know, but those who are not Muslim, if you have some idea about this, it's actually good for you to share with your patient on how can they perform solat, okay, on the bed. Okay, all right. So these are the things I let you read how to go about there. Okay, so this one is actually very important, very good because some patient might not be able to do so. Sama dia tak dapat buat ataupun dia tak tahu. Most of the time they don't know how to do it in the hospital. So it's good for us to know and actually teach them how to do that. Okay, so that in extra, I would say, knowledge and also extra extra things comes from you. Okay, all right. So if you are a Christian, you can actually together pray with them. Okay, that is prayer just now. Okay, other therapies, we have bioelectromagnetics, the study of the interaction between electromagnetic fields and biological entities. We have detoxifying therapies, either it can be physiological or medicinal removal of toxic substance from a living organism. We have animal-assisted therapy, an alternative or complementary type of therapy that involve animal as a form of treatment. Now, of these three, I like the number three most. Okay, most of the time, some of us are pet lover, some of us are cat lover, dog lover. Okay, so animal assisted therapy, where it was proven scientifically, if you are playing with animals, it helps to reduce your stress level. So yeah, you like you have abang cat college, right? Yang kucing tu yang ancam cat tu. So somehow it can help you to release stress as well. Kesana kesini banyak dia punya dayang-dayang tu. Okay, alright. Shikin, Fatihah, okay, Wani. Ini yang orang yang kerap-kerap post dia lah abang the popular. Okay, abang the cat in the college. I'm sure the rest also have it. Okay, and it can be a form of therapy. Okay, all right. So this is what I want to share about the traditional and complementary medicine division. It is already gazetted. Okay, maksudnya ada diperkenalkan di hospital. So it comes in a different form definitely. So Ministry of Health was gazetted under research and technical support in February 2004. The MOH has taken positive and proactive steps to make sure traditional and complementary medicine of high quality and safe to be used by the consumer. So what do we have and what are the services that is being offered? We have traditional massage for chronic pain and stroke, acupuncture for chronic pain and stroke, herbal therapy as an adjunct treatment for cancer. Okay, adjunct treatment maksudnya rawatan sampingan, traditional postnatal care, Shirodara, external basket therapy, environment therapy. These three, Shirodara is like this, yang guna minyak tu. Kalau masa was it Taipusam atau yang sebelum di Bali tu, dia guna minyak tu. So that is Shirodara. So these are the therapies that is being recognized and is also practiced. Not all hospital, okay, government hospital yes, but not all government hospital will have all of this. Okay, for SGH we have bekam, okay, suction bekam, acupuncture not so sure, acupressure, and there's one more, can't remember. Was it massage, if I'm not mistaken? Okay, right? So the last part of the CM, after you know all of the types of therapies earlier on, so what should nurses do? Okay, number one, you should know. That's why I ask you when you do your drug classes, you must know the drug interacts with another drug, the drugs interacts with a disease, the drug interacts with the food, so that you know what to expect and what to tell a patient if they are going to use both drugs and also the therapy that they are using. For example, here, some herbal products may have interaction with prescription medication. Example, garlic, bawang putih, may increase risk for bleeding in clients taking anticoagulants and decrease serum levels of antiviral agents. So if this is happening, okay, so what happen is that kena bagi tahu lah, either you decrease the amount of the medication ataupun jangan makan serentak, for example, okay. Ginkgo, on the other hand, may cause bleeding if taken with aspirin. So aspirin is one form of NSAIDs, non-steroidal inflammatory drugs as well. So selalunya bila kita makan macam ni, garlic and ginkgo, kalau dia makan dalam makanan, it should be adequate. That's why we don't need the extra medication. Tapi disebabkan ada certain, for example, anticoagulant tu, dia, how to say, darah dia membeku. Okay, so what happened is that the intake is not enough, therefore they need the medication to actually help the body to function well. That's why they are on the medication. And of course, when you interview patient, you need to ask thoroughly, ada ambil ubat sampingan tak? Ada ambil herba tak? Ada buat terapi tak kalau sakit? Apa? Selalunya buat apa? Makan ubat ke? Ada pakai minyak ke? Ataupun ambil herba supplement? You have to ask. Because why? If you don't ask and then suddenly patients develop adverse effects from the medication, you tak tahu punca, tapi you tak buat you punya interview very well. So where's the fault there? So that's why when you see patient later on, I want you to talk more to your patient. Get to know what is their lifestyle, get to know what is their practice, especially traditional way of alleviating pain, okay, right? Tanyalah ada ambil ubat tu. Then you learn from them. It's not for you to judge, but at least you take note of what they are using, take note what they are practice, and then you can actually compare that to the doctors. Itu yang akan membuat kamu extraordinary nurses. Okay, right? And of course, kalau doktor tak tanya, definitely patient tak buka mulut lah. Here, we say that patients should discuss with their physician before taking any herbal product or dietary supplements. Kita selalu tanya, boleh tak makan ubat ni bila saya ambil ubat ni? That is good because kalau kita tahu nak memberitahu, kalau tak tahu tak kena tanya lah sampai bila-bila. So that's why it's very important during interview. And be aware of allergic reactions. Okay, if let's say ada allergic when when they started the herbal therapy, ask them to take less than the recommended dose. Selalunya 1 biji, tapi dia develop allergic, so kita kurangkan pada setengah. Kalau dia first time cuba, ambil setengah dulu. Tak ada apa-apa, baru tingkatkan jadi 1 biji. So that is when you take herbal therapy. Okay, right? This is what I told you just now. You should take history of any herbal or alternative therapy from the patient. You should update your knowledge about herbal products. Okay, apa saja yang ada di pasaran, pergi tengok apa dekat over the counter dekat farmasi. Kalau dah dapat keluar nanti, tengok, learn about it. You can ask your parents, you can ask your grandparents, you can ask your aunties and uncles, what do you normally have at home to actually heal the pain or whatever. So from there, the more you read, the more you explore, the better you will be. Okay, one is because you have more knowledge. Second is you are more open. And the third one, you can actually deliver the best care to your patient. So nurses should be supportive and seek to understand the patient's goal for taking the supplement. And remember to educate patient on the role of chem therapies and discuss which treatment or combination of treatments will best meet their health goals. So, kita tak boleh cakap, makcik jangan ambil ini langsung. Kita kena tengoklah kenapa dia ambil mula-mula. Dia cakap senang je dapat dekat belakang rumah ataupun orang bagi. Ataupun ni murah pada ubat yang saya makan doktor. Okay. So we talk about financial burden here. We talk about the difficulty of the patient to get the medication. That's why they opt to use the chem therapies. So how do you want to teach them and educate them and make them understand? So listen to the story. Probably advise them accordingly. Okay, makcik, ini ambil pagi, yang ini ambil petang, boleh ambil. Mungkin ni kita kurangkan makcik, yang ini kita lebihkan lagi. So, bila kita knowledgeable, we know how to educate. Bila kita tak tahu, tak baca, tak equip yourself with the accurate and adequate information, you don't know. Okay, makcik, jangan ambil. Tak bagus. Kenapa tak bagus? You tak pergi tanya, tak pergi check. Okay, and then you tak hiraukan perasaan background patient that might be very difficult to get medication at the hospital. Lebih-lebih lagi sekarang. So what do? They use whatever that is found at home. Okay, so with that, I hope this topic will actually highlight to you, open up your mind so that you can understand about complementary and alternative medication better. Then you will understand the patients better. Okay, so with that, we have a break. Okay, kita rehat sebentar. Okay, and we will continue at 3 p.m. Okay, all right. So let's see. Questions. Any more questions here? Okay, all right. Okay, Nadira was asking, Madam, kalau yang berjalan-jalan atas batu tak pakai kasut tu boleh? Yes, definitely boleh. Reflexology stones. Boleh, sebab dia tekan-tekan juga tapi sakit tau. It's actually sakit and you cannot control the pain. Bila you urut, lebih senang you nak control the tekanan. But on the stone, dia bagus jalan atas batu. Okay, bagus. Alright. Ada pembuli. Tiha pembuli abang. Okay. Alright. Okay, thank you Daniela. Wani was asking, kalau perempuan perlu ke bekam, sebab perempuan kan period kan darah kotor. Okay, apa soalannya? Wani, apa soalannya? Okay, Alicia was asking, is that true if we drink liquid chlorophyll, it helps to clear our skin, reduce pimples? Okay, now, well, you see the testimonial. Okay, I might not know all the products in the market that can actually help in the health. You see the testimonial and you see apa tu peluang macam contoh helps to clear the skin and reduce pimples. Was it actually high or low? Berapa orang yang ada testimoni pasal itu? So normally I will look at the testimonial, komen-komen orang yang membeli, tapi kadang-kadang kan orang boleh komen tau, banyak account dan komen pun kita tidak tahu. And you know that herbal supplement might not have even KKM punya logo. We mean to say they're not unregistered under KKM, but Kalau dia registered ada KKM, like dia ada MAL with the X and then ada nombor 12 digit or 14 digit tu, then it should be safe and it might be proven working lah. Okay, that's my advice to you, Alicia. If you ask me, is it true or not? Okay, sebab banyak sekarang produk dekat market that claim to have can have this effect or not effect. So kena hati-hati. Okay, right? I hope I answered your question, Alicia. Okay, Wani, ada pendapat Medan perlu ketak atau wajar ketak? Well, I never know bekam should be only for men. Bekam, in fact, dia cakap buang angin. Itu yang saya tahu pasal bekam. Tapi effect dia, bila buang angin tu, dia juga sedut and then make you bruises. Ada pengumpulan darah dekat badan kamu tu, okay, because of the suction. Tapi anginnya keluar lah katanya. So if you ask me whether period, waktu period lah, okay, waktu period perlu ke tak? Saya tak pernah dengar lagi lah waktu period boleh buat bekam ke tak. Yang tu kena buat study. Okay, we have to ask because I might not be an expertise of all the CM. So it's good to ask the person who actually study about it. Mungkin boleh baca dulu, Wani. You can actually read about it, bekam, whether it's actually doable during period and whether it's actually sedut. It doesn't sedut darah, it's sedut angin actually. Lepas tu darah tu pergi mana? Dia berkumpul kat dekat kawasan tu. But after that, kalau tak ada apa-apa, dia pandai cair balik. Okay, cair balik and it comes out the flow in your body as usual. Alright. Okay, Wani, boleh maybe try baca dulu. Okay, alright. Any more questions before we go with the next topic? Okay, boleh rehat jap. Okay, 5 minit rehat sekejap and we will come back shortly. Okay, welcome back. Are we ready? Can we continue? Okay, thank you. All right, so let's continue with the next topic, which is about the drug administration through our lifespan. So you will come across this topic again by itself under geriatric, gerontology, orang tua, and also pediatric in next SEM. Geriatric, I think is SEM 5, okay, if not SEM 4. All right. So let's proceed. Okay, so let's proceed, yeah. Okay, so what are the learning objective for today for this topic is that you should be able to briefly explain the pharmacokinetic for different stages of life, especially in pediatric and geriatrics. Pediatrics is kids, children, geriatrics is all people. And you need to understand the dosages of pediatric and geriatric and identify factors related to drug problems in elderly clients. So last week we actually, last 2 weeks we actually talk about drug calculation. I hope, have you completed your drug calculation? Okay, dah habis ke? Nanti dekat, I will give the answers later on, yeah. Can not today, maybe tomorrow. I will type in Telegram and post the questions there. Okay, all right. So let's go with the first drug therapy for pediatric clients. So definitely in pediatric later on you will cover again this topic. So I will go fast with this because even in exam will not be asked about pediatric clients. Okay, all right. So you need to know about ADME. I hope you don't forget about it. Pharmacokinetic, absorption, distribution, metabolism, and excretion. For pediatric and geriatric and normal people, they are different. Okay, so these are the theory part in which you need to know what are the difference between the pediatrics. The normal adult we have already covered earlier on in chapter in topic 1 and 2, and for all people at the end of the slides. Okay, so let's talk about absorption first. So for kids, for pediatric, the topical absorption is faster. Topical means ubat sapu. Okay, ubat sapu. Okay, why is it so? It's because they have thinner skin and they have disproportionate of skin surface area. So basically, budak, okay, kalau kamu perasan, baby, kita tak bagi ubat tau. Bagi ubat macam tu, kita main sapu. That's why kalau you buat, you pakai lotion ke, you pakai minyak UE ke, EU ke, okay, alright. Minyak baby yang bau eucalyptus, itu bau sejuk-sejuk sikit, okay. It is actually better for them because their absorption is faster and thinner skin. You pakai Vicks, lebih baik daripada you bagi dia makan ubat, that kind of thing. And even if you want to inject baby, you tak bagi anesthesia. Okay, so what you do, you have EMLA cream. EMLA cream, EMLA. EMLA cream is to actually buatkan area tu numb, jadi baby tak berapa sakit lah. Also, is also topical absorption. Okay. And you need to know as well, exhaustion sekiranya, if the pediatric, the kids, the babies and the children have to take the medication orally, okay, you need to know that they have reduced gastric emptying, okay, reduced gastric emptying, and intestinal mortality, increase the time it takes to reach therapeutic concentration when enteral drug is given to an infant, especially less than 3 months old. Selalunya sebab itulah kalau dia kurang daripada 3 bulan, we don't really give, how to say, encourage to give medication by mouth. So kalau ada apa-apa, terus injection. That's why you will see that nanti pergi buat kanak-kanak, baby-baby yang sakit, kebanyakannya ada line. Why? Because the actually the exhaustion is better using the direct skin, which is the, what do you call that already? Parenteral route. Okay, and they have reduced in gastric acid production. Therefore, it may decrease the absorption of medications that need acid environment, especially ubat yang memerlukan acid environment, which is in the stomach. Okay, now that is absorption. What about the distribution? So total body water in infants is between 60% to 85%. So there are more water in the infants, in kids. Therefore, infants may need higher dose of water-soluble drugs as compared to other drugs. Jadi ubat yang dipilih oleh doktor perlulah water-soluble, because why? There are more water inside the kid's body, whereas adult 55%, and we have fats. So we have fat-soluble drugs and also water-soluble drugs. And at the same time, when I said that, remember they have more water in their body, therefore the body fat is less. The dosage of fat-soluble drugs must be varied to achieve desired effects, especially antibiotics. So they can adjust lah. Pediatrics is actually more, how to say, we need to carefully monitor and also consider what type of medication to be given. Itu kerja doktor lah, but you must know that the rationale, it is not the same as ubat orang biasa, orang tua, or adult dewasa to be given to the pediatric patients. Okay, and they have decreased protein binding. When you talk about decreased protein binding, kebanyakan the things that they took orally or might not be able to bind the protein, and the ikatan dalam tu will not be able to be bound and be distributed in the body. So dia akan jadi merata-rata tempat, and that can cause toxicity as well. And the blood-brain barrier, okay, bukan bisha-bisha, okay, 3Bs, is immature, therefore drugs senang nak enter dalam brain. Dia belum berfungsi dengan sebaiknya. Sebab tu sekiranya, for example, if the mother took something when the mother is pregnant, it can harm the baby's body, not only physically but also mentally. So we have brain damage there. So blood-brain barrier is a selective physiological or anatomical capillary barrier that prevents potentially harmful chemicals from reaching the parenchyma of the brain. So for kids, they are not matured yet. Okay, next, metabolism, ADM. Okay, ADM, the levels of enzyme used to break down the drugs chemicals are decreased because why? Liver belum matured. So basically most of the organs in the kids body is not matured yet. So banyaklah reduce dia punya fungsi sebetulnya dikurangkan ataupun terkurang because of immaturity. Okay, then we talk about excretion. Excretion keluar. So what happened? Glomerular filtration rate is 30% to 50% lower than adult because of immaturity of the kidney. Kidney pun belum berkembang dengan jayanya lah, membesar dengan jayanya. And the urine pH is lower in infants and urine is less concentrated, resulting in medication circulating longer. So sebab urine dia tak apa keluar banyak, bila terambil lebih banyak ubat, so the medication in the body of a pediatric can circulate longer, berada dalam tubuh dengan masa yang lama, and also risk of toxicity. So basically it will do harm than good to the pediatrics. Okay, so here are the ages and stages of pediatric that you should know. Infants are from day of life, 0 to 1 year, so they are called infants. Bila dia dah masuk 1 to 3 years, they are called toddlers, okay, kanak-kanak. preschoolers yang dah mula masuk tadika 3 to 5 years. Okay, so if you look at here, pediatric dosage that we have actually come across this last 2 weeks, remember you need to determine the safe range for the baby first. Tukar weight dari pound ke kilogram. After that, you determine the dosage berapa kali satu hari. After that, you make sure that the safe range is within normal range. So, banyak kiraan. So, it has to be very careful. And if you can see in the picture here, okay, can you see very cute tiny stethoscope? Yes, this is available for kids, for babies. Okay, if you see the one yang macam lekat dekat bawah ni, bawah ni adalah temperature probe. Yang ini kalis kalis suhu lah, so that it will not actually interfere with the reading that is attached, the probe attached there. So ini dipanggil temperature probe on a baby skin. Okay, baby skin. And there are rules based on age just now. Okay, umur ikut umur, definitely the dosage will be different based on weight and based on body surface area. So this is just for you to know. Tak ingat tak apa, nanti time pediatric baru kamu ingat balik ya. So we have Fright's rule and Young's rule. So this is based on age. So for newborns means 0 day of life until 2 years old. 18 months over 150 times normal adult dose. Yang ini formula dia. Don't ask me why is it 150 ya. Okay, right? So you can actually just for you to know, Young's rule for ages 1 to 12 years old, 18 years, and then times normal adult dose over 18 years plus 12. Ini dia punya dose, the dose that the doctors will actually calculate. We don't normally use rules based on age. Dekat Malaysia kita banyak guna weight. Weight. Right, weight is like the other day that I have actually shown you how do we do it. Okay, if you see here example, amoxicillin 20 mg per kilo, maksudnya setiap 1 kilo 20 mg of body weight to be administered 8 hourly. 8 hourly is TDS, 3 kali sehari. Okay, so what happened? You have a child weight is 20. Okay, the dosage is 20 times 20, you got 400 mg. Then you equally divided to 3 doses. 400 bagi 3, you get 133 mg to be given every 8 hours. Yang ini very straightforward. Okay, faham? Okay, berat 20 kg. Lepas tu order dia 20 mg per kg. So you slash, you tinggal 20 times 20, it's equivalent to 400 mg. Now this 400 mg is per day. So here to be administered 8 hourly. And how do you get 8 hourly ni TDS? 3 kali sehari. 24 divided by 8, you get 3 times, 3 kali. So that's why you get 3 equal doses. So 3 kali. So each of the dose, how much? 400 mg divided by 3, you get 133 mg, and this is to be given every 8 hours. So this one is very straightforward question. Okay, right? Now, next is body surface area. It is most accurate. Estimate the child's body surface area in square meters and to refer to nomogram. Nomogram ni nanti kamu tengok dia macam buku apa tu? Buku sifir ke? Buku something, I can't remember. Square root. So here's the formula: child surface area in square meters times adult dose over 1.73 meter square. This one is surface area of an average adult already given 1.73. So bila you masukkan kat situ, you tengok macam ni. With the height 120, you put across. This is nomogram. Kalau macam a table tu, kita tengok nanti I think I have that. So this is body surface area, BSA. So 120 kalau you buat macam ni, weight dia dalam 42 kilogram. So you can see that. Okay, after that you akan pergi ke page seterusnya, which is the table. I think I deleted that earlier on. Oh no, it was in the drug calculation. Okay, was it there? Never mind. So doktor akan ikut the body surface area of the baby, and then dia akan dapat umur dia, berat dia. After that dia akan calculate. So dia banyak kerja lah. So doctor pediatrician has to be very very careful. Okay, now let's look at the routes of administration for pediatric. Okay, oral medication administration. Children below 5 years old cannot generally swallow pills and capsules. Dia tak dapat swallow. So definitely, what do? We need to change the way the medication is given. Probably change what is the type of the medication given. So because of that, when they cannot swallow pills and capsules, they don't want to take the medication. Therefore, you need to give in liquid form, the elixir, syrup, and suspension, which we have talked about this and discussed this in before Raya. Okay, what is the elixirs, what is syrup, and what is suspension? And if let's say there's no medication found in the liquid form, then what you do? You crush the tablets and capsules are open and mixed with 1 spoon of food. 1 spoon of food. Okay, ada orang campur dekat makanan. Ada orang, maybe your parents, okay, give you syrup campur dengan air oren. Ingat tak, letak kat sudu, letak kat oren. Okay, or letak air biasa, sedia air oren dekat botol susu, ngap masuk mulut, lepas tu minum botol susu oren. My mom always did that. Ubat Panadol setengah, dia buat pahit, but my mom already prepared 1 full bottle of nenen, okay, air oren lah, then top. Jadi lama-lama hilang rasa pahit dia. So that's how you can actually tell the mother how to give the medication to kids, especially to kids. So no choice, tumbuk, ubat tu campur air, make sure dia macam tu, ngap terus, letak botol oren. Itu. So how about you? How did your parents do or paksa you makan ubat before this? Can anyone share with me? Or can anyone share in the group how did your parents actually tell you or ask you to eat ubat? Adakah kamu tak pernah sakit time kecil-kecil? Bagus jugalah kalau tak pernah sakit. Anyone wants to share? Wani pancuh dalam air. Air apa ya? Oh, air oren Wah. Nasrin threatened with injection. Lagi hebat. Kejamnya ayah awak. Tak apa. They have their own style. Okay. Danella, we sing birthday song. I don't know what it helps though. Wow, birthday song. Macam mana tu? Oh, that's interesting. First time. Nyanyi birthday song, lepas tu letak dekat mana ubat. Okay. That is quite interesting. Abdul Rakib, I sirap. You are answering Wani's explanation, is it? Nurain tak bagi tak campur apa-apa, bagi macam tu. Bagus yang kau. Kecil-kecil makan ubat dah pandai ya. Okay, gel belah 2, suruh telan saja. Kesian kami. Patricia, ready hanger. Apa? Memang ada cara yang ganas lah. Air putih je Wani. Okay. Alright. Okay, air putih. Bancuh dalam air. Yeah, that's what I do. My mom do. Air putih. Tapi dah sedia air oren kat tepi. Yang hanger tu tadi dengan injection tu, boleh tahan lah. Boleh tahan. Kesannya sampai besar saya tak pandai makan ubat. Yalah, minta-minta jangan sakit lah Wani. Okay, jangan sakit. Okay, alright. Vivian, my parents cakap ubat tu gula-gula. Wow. Yeah, masa kecil we believe kan? Kita percaya, we don't question. Okay, we don't question. So, we actually take it. Sampai makan gula-gula. Okay, very good. Thank you very much for sharing your experience. Okay, so you have your experience as well. Okay, how your parents sit. Kalau dekat hospital tak boleh ambil hanger, tak boleh cakap nanti cucuk tau kalau tak nak makan ubat. Jangan Okay, right? So kita kena guna cara yang lebih efektif dan tak menakutkan. Okay, tak menakutkan. Thank you very much for sharing. Okay, alright. So cool. That's cool. Okay, right. So continue. Okay, never crush anteric-coated or time-release medicine. Remember, kalau perlu juga, you renam dalam air lah. Renam dalam air panas sikit or suam-suam sikit. Okay, and then for amount less than 1 ml, kalau ubat yang diberi itu sikit saja, use a 1 ml syringe. 1 ml syringe. And then most important thing, bila bagi ubat, mesti position the young children upright, duduk. Okay, to avoid choking and aspiration. Aspiration is like the tendency of masuk ke dalam paru-paru. That is aspiration lah, in a term that I will actually easy to explain to you. Okay, yang masuk dalam paru-paru. And then give liquid medicine slowly by oral syringe and at the inside of the cheek. Now, when you talk about inside of the cheek, kalau you bagi ubat nanti, okay, when you bagi ubat inside of the cheek, maksudnya dekat pipi, dalam pipi, bukan tengah-tengah tau. Nanti keluar. Okay, so dekat tepi dalam at the corner inside the cheek, you tembak sikit. Macam bagi epiton, you tak tembak tengah-tengah, you bagi sikit, especially baby. Sangat cute bila you bagi ubat pakai syringe. You picit, lepas tu dia orang selalu suka punya tu. Okay, cute je, macam isap-isap. Kadang-kadang what I do from my experience when I gave medicines to baby last time, saya letak syringe tu dekat tengah dan saya tak picit, dia suck. Dia suck. Dia macam puting lah. Puting. So dia akan suck. Pandai dia suck. Kuat lagi tu. Dia macam tu. Okay. And then kalau let's say the baby is weak, then you put at the end of the cheek, of the lips here, but tembak ke dalam the cheek, not in the middle. Okay. I'm not so sure how many of your parents did that using syringe before. Okay. Ubat yang memerlukan yang cecair lah. Okay. Right. Okay. Now, a preschooler tadika yang dah pergi sekolah, so they might prefer to drink the medicine from a medicine cup. So kita bagi dalam cup lah, cup kecil. Let the children choose the type of fluid to drink after, but do not ask if they will take the medicine now. Maksudnya, sepatutnya dia makan ubat time ni. So kita cakap, do you want to take it now or later? Jangan tanya itu. Definitely dia akan cakap later. Bila later, so dia tak akan ambil. So cara untuk kita pujuk budak-budak kalau makan ubat, kita tanya nak makan ubat ni dengan orange ke nak dengan cherry. So we can actually ask them to choose the type of fluid. Okay, that's what this sentence meant. Okay, so that is oral. Oral. Now for rectal, dari Anas, for rectal, for children under 3 years old, 3 tahun dan ke bawah, use the fifth finger. Sebab dia kecil. Masih kecil lagi. So, you cucuk pakai ini. Okay. Anyone above 3 years old termasuk adult, you use index finger. Index finger is the second finger. Below 3 years, use the fifth finger. Jangan guna ini yang untuk besar. Nanti koyak orang punya anus. And then make sure you lubricate the tip of the suppository. Remember macam bom tu yang macam ada bucu separa tajam tapi sebenarnya tak tajam pun. Okay, lubricate it first. Okay, masukkan and then hold the buttocks together. Hold the buttocks meaning you kempitkan dia punya batok, baby punya batok kan. You cannot tell them, pergi kempitkan dia punya punggung. Dia tak tahu. So you kempitkan dia. Okay. Together for a few minutes to keep the medicine from being expelled. Takut dia terkeluar dan terkena engkau balik. Okay, so you tolong pegang dia punya. Kalau let's say adult, you can tell them, okay, tahan. Jangan macam you tahan nak terantai tu. Macam tu. Tapi kalau dia comatose patient, we have to hold for it. Hold for a few minutes. Okay, Lepas tu ada pampers, letak pampers. Normally kita buat macam tu lah. So some of this you might not have actually been told, but there are skills that you will have to learn it on the spot when you nurse the patient. Baru tahu. Okay, right? Okay, that is rectal. Now, ophthalmic and otic. Ophthalmic is the eye, otic is the ear. Now, young children may be fearful of medicines placed in the eyes or the ears. So, how do you want to put as well? Adequate immobilization. Okay, what does immobilization? You tahan. Tahan, you needed to avoid injury. So the nurse hand can be stabilized by resting the wrist on the child's head. Nanti ada gambar. Explanation and therapeutic play can be used with children old enough to expand the process of administration. And don't forget, have medicine at room temperature. Selalunya ubat mata dan ubat telinga disimpan dalam peti sejuk. So bila nak bagi pada patient, especially kids and old people, kamu kena keluarkan dulu daripada peti sejuk supaya tak mengejut bila terkena mata, terkena telinga, sejuk tu tak terkejut. Okay, so this is how you do it. Right? Kalau baby, ini cara salah ni. Sepatutnya pegang dia punya muka and then put the ubat and then the wrist rest dekat tu and then you titikkan dekat mata dia. Dia kena pandai lah buat titik dekat the conjunctiva dekat bawah ni conjunctiva. I hope you know your anatomy. Before the holiday we have that anatomy on the eye. Okay, so after that baby akan klik mata. Okay, good. Nanti jangan lupa kalau ubat mata you kena picit dekat lacrimal duct. Okay, lacrimal duct dah. Why? Sebab kalau kamu tak picit, okay, kalau kamu tak picit, nanti ubat mengalir ke dalam hidung dan melalui tekak akan rasa pahit. You just imagine, you pun rasa pahit, what more to say the baby. So, kena buatlah. Kena buat gently. Kena gentle dengan baby. Picit kat sini supaya ubat tu tak masuk ke dalam hidung dan pergi ke tekak. Alright? So that is ophthalmic. Now otic. Otic what happen? You tarik dia punya cuping. Okay, cuping kat bawah and then you titiskan. Sama jugalah. You kena kawal dia punya kepala. Kadang-kadang if you cannot do it alone, you need someone to hold the baby while you are administering the medication. Okay? Alright, sebab tak expert lah, tapi tak apa. You can always ask for help. Okay, alright. Now, go back to the topical. Topical is ubat sapu. Okay, remember I told you the skins of the infants is thin and also fragile. So only prescribed doses and medicines appropriate for young children can be used on the skin. And most of the time we need to cover the area or keeping the child's hand away from the area is necessary to ensure adequate contact of the medication with the skin. Let's say memang ada ubat sapu, cream for example. We don't want the other hand, sebab dia tak tahu, go and wrap it and then kotorkan. So what do? After you letak dekat tangan dia, you wrap it maybe with bandage, loose bandage ataupun gauze so that the baby will not, kacau the area of the topical. Okay, next is intramuscular injection. Okay, gluteus maximus muscle. Okay, gluteus maximus muscle is the muscle of your ass. A-S-S-S. Okay, scientific name for ass is ASS, punggong, is gluteus maximus muscle. And this one you need to know. Gluteus maximus muscle for kids 1 year and below tak boleh digunakan. Kamu tak boleh cucuk dekat punggung dia. Tak boleh. Okay. Not until the kid started to walk. Sebab apa? You remember, if you watch my video, my explanation on the video on parenteral, ada sciatic nerve. And that sciatic nerve, kalau terkena dengan baby, especially belum berjalan, you cucuk dekat punggung dia, terkena dia punya nerve tu, baby can become paralyzed. Kamu nak bertanggungjawab? Tidak kan? So, do not use the area. There is this what we call vastus lateralis site for young children. Vastus lateralis site will be at your thigh, tepi thigh. Nanti ada gambar, alright? For children, cucuk kat situ. And amounts of medicine should not more than 2 mils for ventral gluteus side, depending on the muscle size. Okay, ventral gluteus will be slightly upper your gluteus maximus. And for deltoid muscle, which is here, your arm, commonly used for small amount of vaccines, such as the injected subcutaneously, like MMR, okay, measles, mumps, and rubella, and JE, Japanese encephalitis vaccines. Okay, all right, so that is it. So this is what I told you. Vastus lateralis. So you have your laterofemoral, condyle, and then your greater trochanter. You akan rasa tulang yang paling besar kat sini. Okay, after that you imagine, okay, bahagikan pada 3 petak. So petak yang kedua adalah tempat awak inject lah area ini. Okay, so the injection site is the junction of middle and upper thirds of the vastus lateralis. Pun boleh kat sini. Okay, not too low, not too high, just in the middle. Right. Now, intravenous is into the vein. The veins of the baby of the pediatric are small and fragile. And if you want to masukkan drip for the babies, you akan tengok dia punya drip kecil-kecil, cute-cute saja nanti dekat pediatric. And when you talk about drips, you must consider critically about the fluid balance. Tak boleh lebih, tak boleh kurang. Lebih kembang. Kembang tu memang susah lah. Okay. And the careful maintenance of site is needed because baby, they don't know that they have a line. They tend to gerak-gerak. So what happened? Tercabut ataupun merah, kita tak perasan. So need to check every hour if possible, or every 4 hours that you can actually, when you assess the vital signs, you check the sites. And the common infusion sites are hands, selalu yang kamu akan tengok dekat tangan, at the feet. Now, special in infants, maybe dekat kepala. So I will show you the picture later on where there is a line at the scalp area. And if the baby is using infusion pump, it requires frequent monitoring as well. Syringe pumps are used when minimal fluid are to be given. Syringe means in the syringe. So you, let's say you nak bagi 10, you pakai syringe pump. Infusion pump is the drip, pasang dekat tu, so you nak tahu berapa run every hour. And then we also use central line, especially a very sick baby. Kita akan buat central line di mana ada 3 tempat untuk kita masukkan ubat, and then terus-terus there are baby who are very, very sick. So we need to have that central lines supaya tak perlu cucuk banyak kali. Okay. So here, this is the hand of the baby, ya. Hand of the baby dipicit, okay, and then dicucuk buat line. So let's say tangan tak dapat. So next one is the scalp. You akan tengok line dekat kepala. Kenapa dekat kepala? Because their vein are still visible and masih boleh dibentuk. That's why kalau baby less than 1 year old, you cannot how to say, main-mainkan kepala dia because it can cause permanent shape. Kalau baby shaken ke, kalau baby kena pukul ke, memang akan membentuk lekuk yang kekal. Because remember, when they are still, how to say, when they are still baby, kepala dia masih fragile, masih boleh dibentuk. Inilah tujuannya kenapa masa beranak, ibu beranak, dia ikut saiz ibu tu, kepala dia boleh melekuk macam tu. Dia pandai adjust ikut saiz cervix ibu. So that's why the head, the scalp is actually very, very fragile, especially for 1 year and below. Bila dah lebih daripada 1 tahun, normally dah harden. That is how you look lah. Okay, until today. So your head never change unless you have trauma, accident yang teruk, dan membentuk lekuk ataupun awak pernah buat pembedahan otak, then yes, it will change the structure. Okay, so that is intravenous. Okay, so finish with pediatric. Any questions on pediatric? Okay, I might take some more time for today. Let me finish up the adults. Any questions on pediatric before we go with adult? Okay, ada soalan tak? Do you have any questions? Any questions? Let's have 5 minutes break. 5 minutes. Give me some time. I might extend a little bit from beyond 4 p.m. No questions? Okay, thank you, Jill. All right. Okay, good. Color clear. Very good. Okay, good, good. Good to hear that. Okay, let me continue, yeah. Okay, continue. Since there's no, because it's clear, hopefully it's clear. Dan awak tak merayau ya. Harap dengar baik-baik, okay? Alright, so next part, we look into the drug therapy for the adults. Okay, for the adults. Yang ni lebih kepada later on for all adults. Okay, alright. Now, young adults and pharmacotherapy, um, especially you young people, you might need minimal of prescription drugs unless you have chronic disease or immune related condition. Otherwise, you are all healthy. Okay, kebanyakan orang muda-muda kamu ni sehat lah. Hopefully sehat sampai bila-bila. And you might have positive medication compliance where nurses should educate about substance abuse and treatment of sexually transmitted disease. Remember ABC I told you how to prevent from getting the sexual transmitted disease. Let's do some homework. What is ABC? How to prevent sexually transmitted disease. What is A, what is B, and what is C? Come on. How to prevent sexually transmitted disease. A, V, principles of A, B, and C. Okay, what is A, what is B, what is C? Ni pernah cakap ni, Sem 1 dah. I actually talk about this. What is A, what is B, and what is C? Okay, mari try. Kita cuba. How do you prevent sexually transmitted disease? A, B, C. But not all, not all. Most of it. Okay, most of it. One of it is HIV. Okay. Gonorrhea, syphilis. Kalau also if you do A and B, A probably okay, tak akan dapat. B, kita lawyer, dah bagi jawapan pula. Awak pandai betul kondom, Okay, right. Terus rakib C, kondom. Okay, A, say no, or we call it abstinence. B, seek lawyer, be lawyer to your partner and C is condom. Okay, very good. So, Alicia dapat tu. Okay, let me type again. A for abstinence. A, B for be loyal, and C is condom use. Okay. Alright, ada yang dapat full, ada yang tak dapat. Okay, good job. Okay, at least ada ingat sikit abstinence. Say no. Say no. Okay, alright, very good. So that is how you actually prevent. But then again, kalau kita lawyer, partner kita tak lawyer, we still can get the sexual transmitted disease. Okay, condom use will be how to say working if to prevent pregnancy, to prevent HIV if it is used properly, definitely. Other sexually transmitted disease, depending on how is the method being used, can still be transmitted as well, like syphilis, gonorrhea, chlamydia. Okay, right? These are all the names of the sexually transmitted disease. Okay, right. Very good. Let us continue. Okay, now that is young adult. Now, middle-aged adult is the one yang dah nak masuk peringkat 40-an, okay? The changes begin around 45 years old, 45 years of age. These are the time, the phases where they are having prescribed drugs, basically because of stress, okay, stress. And why they are stressed? Because there are lots of numerous life transition. Contohnya kahwin, pindah rumah, kerja, tempat kerja. So these are all life transitions. So well, this is where people started to have hypertension, asthma, diabetic. Sebelum ni tak ada pun, tapi tiba-tiba umur ni ada. Kalau dia tak ada history, dapat benda ni is because of stress. This is what we say stress-related illnesses. Therefore, you need to know how to distress from the beginning so that bila you dah meningkat dewasa, okay, you will know how to handle stress better when you are at 45 years and above, okay? So what do? You have positive lifestyle changes that could prevent drug therapy. So pergi jogging, distress, pergi happykan diri. So when you do that, hopefully all of you will be protected against any illnesses, okay? So this is how we treat the middle-aged adult. They have to do ECG here. Okay, tengok jantung dia okay ke tak. This is where the changes of the body size also happening. Okay, alright. Daripada yang tagap-tagap dulu, lepas tu pandai memboncis-boncis. So this is where because people are practicing sedentary lifestyle, and therefore when you do that, there are more things coming in lah, penyakit-penyakit yang tidak diundang tapi datang juga. Okay, dia bertandang nak raya, tiba-tiba. Okay, so the illnesses that require drug therapy, contohnya, we have all the cardiovascular disease. Okay, cardiovascular, heart attack, stroke, hypertension, okay. What else? You have your cholesterol tinggi, cholesterolemia, okay, and then you have diabetes and stomach cancer, obesity. That is the illnesses that started at the middle age adult. Okay, next we go with the geriatric, older adults. Okay, older adults and pharmacotherapy. Earlier on, we started with pediatric, very young. Now we go with the old one. Okay, now older adults and pharmacotherapy, if you know, okay, and I'm sure you have seen it, I'm sure you notice, they take multiple medications concurrently at the same time. Concurrently means at the same time, and this is where we talk about polypharmacy. Polypharmacy, makan ubat yang banyak dalam satu masa. Okay, some predictable ailments but much variability remains. And we can see more adverse drug events in geriatric patients. And we need to use reminder aids for administration if we want to remind the older people because they tend to forget to take the medication. So let's look at how we should treat older adults. Okay, but before that, you must know the ADME, absorption, distribution, metabolism, and excretion in older people. So the first thing, absorption, in older adults, okay, basically 60 and above, we will have diminished gastric motility, and then we have decreased blood flow to digestive organ, therefore gastric emptying is lower. When it is lower, the rate of passage of drugs through the lower GI tract is also slower. So they tend to retain longer in the body, slow sampai ke tempat yang sepatutnya. That's why tengok BP dia masih tinggi after 1 hour. Tengoklah after 2 hours, then BP started to slow down. Kalau dia ada ambil anti-hypertensive drugs. Okay, right? And then the decrease of absorption surface in the intestine because there is a reduction in blood flow. However, when the old people use the topical absorptions, sapu, it will be faster because masa just now pediatric, now older people, kulit dia orang akan jadi nipis. So bila nipis, absorption will be faster. Sebab tu orang tua, bila orang dah tua-tua ni, suka pakai ubat sapu. Ubat kapak, minyak kapak, ubat kapak, minyak kapak. balsam, tiger, koyok, everything. Dia orang akan letak. Itu tanda tua lah tu. Okay, alright. And then, if you want to give injection, IM absorption may be altered because of variations of vasoconstriction and vasodilation of the peripheral circulation. So, dia punya vein ni taklah macam muda-muda lagi. Okay. So, distribution, AD, D, next, more body fat. So, need more fat-soluble drugs that has to be absorbed and released more slowly into the bloodstream. So when there is less body water, sebab fat dah take over, there is a decreased distribution of water-soluble drugs. And at the same time, sama juga macam budak pediatric, they also have decrease in protein binding capability. So dia mulalah merata-rata di badan dan dia boleh menyebabkan toxicity di dalam orang tua. Okay. Now next, the liver produces less albumin, therefore decrease plasma protein binding ability, increase levels of free drug. Free drugs is the one I told you just now, ubat merata-rata dalam tubuh, that can increase potential for drug-drug interaction. Remember, polypharmacy, makan ubat ni, lepas tu tak sempat lagi nak pergi tempat yang patut because dia merayau, dia merata-rata because there is less protein in protein binding. Jadi dia akan buat drug and drug interaction. Patient akan mengalami side effects yang teruk, okay, adverse effects, and worst case scenario would be death. Alright. And then decrease cardiac output, jantung dia dah lemah, and therefore the blood circulation is not really as strong as when they're young. The loss of muscle tone may alter distribution of drug, especially through intramuscular. Orang tua-tua, dia tak macam kita yang macam gebu-gebu. Gebu-gebu. Okay, dapat gebu-gebu. Bila dah tua, you pun tengoklah kalau ada masih ada grandparents kan, dia akan mengecut, lepas tu tinggal macam skin saja. So, isi tak ada. That is what we say about loss of muscle tone. Alright? And ADM metabolism is reduced in older adults. Reduce first pass metabolism. Remember with first pass metabolism maksudnya perlu lalui after stomach, kena pergi liver and then stay there for a while before they can go to the whole body. So there's a reduced first pass metabolism, mungkin lebih lama. Okay, decrease production of liver enzyme which is P450 yang boleh detox the medication. Jadi bila macam tu decrease production, so either dia akan menjahanamkan ataupun membebankan liver, okay, alright, because there's not enough liver enzyme to detoxify the medication. So lebih banyak ubat makin rosak lah dia punya liver. That's why orang tua ni kadang ni sometimes because of the heart liver failure, the cause of medication can be a cause of death as well, or it can be other things. I would not say solely on the medication, but it's actually a mixture and a combination of all other things. Ubat dia, keadaan dia, and then the nature, which is all the people, they will have everything low and reduced in their body. Okay, and then the increased half-life of many drug. Half-life dia sepatutnya 8 jam tapi jadi 10 jam. Kenapa? Sebab ubat masih belum clear lagi daripada the body. Remember, half-life means 50% of the drug is being excreted or being removed from the body. That is half-life. And then there is tissue concentration in the body increase, decline in the body's ability to transform active drugs into inactive metabolites. That comes in the form of urine, that comes in the form of tahi or sweat. Because orang tua ni jarang betul kalau mau sweat, they are always cold. So that is why the body itself is not longer working well. Therefore, whatever it takes, it is slowed and it is actually reduced. What more to say, if the patient, older people take more than one type of medication. So, excretion, because the kidney is no longer as good as when they are young, there will be reduced renal failure, blood flow, reduced glomerular filtration rate. Your friend will actually talk about this in anatomy and physiology, what is glomerular filtration rate, yeah? And then decrease active tubular secretion, decrease nephron function, and then decrease drug excretion for drugs processed by the kidney, therefore resulting in drug toxicity. Bila kurang dikeluarkan dari badan, maka tertinggallah ubat-ubat di dalam badan dan menyebabkan that drug berkumpul menyebabkan toxicity. This is what we actually understand from toxicity, the accumulation of drugs. Okay, so with that understanding, you must know other things as well, problems related to elderly when we want to give medication or they are at home. There will be problems in them uh, taking the medication. Okay, number one, very important factors that will affect or that is related to drug problem in elderly is sensory losses. Okay, dia tak nampak, kurang mendengar, lepas tu tak dapat rasa, the taste is not there, the smell, tak tahu dia dah busuk ke, dah basi ke, okay, and that will affect the ability to manage medication accurately, especially when you cannot see. Ini apa ni, bujur bulat, nampak putih semua, tu very very difficult. And then when we say to them, ini makan 2 kali sehari, kari, dia dengar salah. Also problem with drug. Nanti makan kari pula, dia tak makan ubat dia 2 kali sehari. Okay. And then older people will have problem with loss of recent memory. Baru saja kita bagi tahu dia dah lupa. Pakcik nanti balik ni makan ubat ni? Ya, balik rumah tak makan, tak ingat. So how do we do that? Okay, we need to write it down. Ataupun kalau ada telefon, ada anak yang pergi ikut ambil ubat, kita bagi tahu anak, suruh remind the parents. Okay. And then polypharmacy, taking many types of medication several times a day, so they get drugs. Ini best polypharmacy. Contohlah, kalau you perasan lah, nenek-nenek kita suka stok ubat. Macam nenek akulah, nenek madam dia letak stok ubat dia dalam tin kuih ke, tin cookies ke kan. Dulu-dulu lah tak ada container Tupperware, okay. So letak dalam tin tu, letak dalam tu, semua ubat dalam tu. Okay, polypharmacy. So siapa kalau orang bagi dia, okay, ambil simpan sampai expired tak. Yang ni best. Lepas tu apa terjadi? Bawa kong ubat tu pergi share dengan orang bilik sebelah. Kata dia, sakit apa? Pening kepala. Jangan risau. Saya ada Panadol. Dia cari Panadol. Dia bagi jiran di sebelah. Sakit apa? Darah tinggi. Share lah kita dua. Sharing is caring katanya. Tapi it's not the right way to do that. Okay? Right? Especially orang rumah panjang. Okay. I'm not so sure. My grandma and the grandma next door and the grandma next door, they like to share medication. Bisa ubat pada kepala, dek. Translation. Ada ubat sakit kepala kah? Bisa ada. So dia pergi korek dia punya kong ubat. Nah. They like to share. Especially those who are very close and actually next door. Rumah panjang masih buat macam tu. Kalau rumah neighborhood dekat mana, not really. Cannot really. So this is also a problem there, because not all medications are actually safe to be taken and it's the same for everyone. That person might not be able to use that. Kalau over the counter, not bad lah, not bad. Kalau ubat darah tinggi ni tak boleh sewenang-wenang bagi orang tu tahu. Dia mungkin ambil ubat darah tinggi lain. Yang ni ambil ubat lain. Nanti efek siapa salah. Susah pula. Nanti gaduh pula orang sebelah-sebelah rumah kan. Susah pula. Tak gawai gitu ya. Okay. Some of the things, malas nak pergi hospital, pergi cari ubat dekat counter OTC, over the counter, farmasi sendiri. So such, for example, laxative. Laxative is helping the poop to go out. Berak senang. Okay. Ni as I told you, stored unused medication and take them when needed. Simpan banyak-banyak, guna bila perlu. And then sharing medications with a friend. Katanya sharing is caring gitu, katanya. Okay. And then orang tua ni selalunya selera dia kurang. So bila kurang, they take low protein diet. And at the same time, they ada yang kuat minum lah bila dah tua ni, kuat minum. Especially, I'm not talking about the Malays, the Chinese, but the Iban, especially Iban Bidayo, bila dah tua makin kuat minum. So when they take medication and also alcohol at the same time, kurang makan lagi, that can contribute to adverse drug reaction. So banyaklah efek dia. So salah siapa? I don't know salah siapa. Kadang-kadang dah degil sangat, tunggu nak matilah tu. Okay, jahatnya. Tak adalah. Tapi you will see what I said is reality that is happening in our everyday life. Okay? And of course, communication problem is a problem. Cannot understand the technical language, do not want to admit lack of understanding and refuse to ask. Ini kalau tidak mau bertanya lah, sesat jalan. Okay? Right. So, how we nurses can administer drugs to the elderly? First and foremost, kalau the question about this, you can always answer the first one, follow the 10 rights. I hope by now you remember what the 10 rights are. You have your right drug, right dose, right dose, right time, right patient, right route, and then you have right documentation there. Then you have right assessment, right evaluation, and then right patient education, right to refuse, and lastly your right for documentation. So you must know all the 10 rights, okay? And when you give oral medication, just like kids, orang tua ke, orang muda ke, as long as they are a human being, okay, you need to position them in an upright position. Duduk, most of the time, duduk. Let's say you tak duduk dekat kursi, it's okay. When the head of the bed, you need to raise it up at least to semi-fowler's position or high fowler's position. And if patient has difficulty with tablets and capsules, tak dapat telan, you use liquid medication. But this one, you kena bagi tahu doktor, patient tak dapat telan lah, boleh tak kita bagi sirap? So doktor cakap, kenapa nak bagi? Patient tak dapat telan, dah tua-tua, susah nak bagi dia ubat. Daripada dia tak nak makan ubat, kita tukarlah ubat. Ubat tu ada. You justify. Definitely doktor akan dengar cakap misi. Okay. Number 4, do not rush the client. Ni orang tua lah, slow-slow. Kadang dia, when they have Parkinson very slow. Very slow. So do not rush. Cepat gitu lah, pakcik. Kami tu ada banyak kerja. No. Wait for them. Do not rush. Prepare the water. Ask them to swallow. Remember, I told you there is one time when I was still in hospital bahagia, Tanjung Rambutan, makan ubat macam ni. Lepas tu lama, 5 minit dia makan. Dah tua-tua lah tapi we don't rush. Kita tunggu. We wait. Okay, we wait as long as dia makan ubat. Okay. Alright, and then provide a sufficient amount of water to drink to ensure that the medications are swallowed and reach the stomach. As I told you just now, while waiting, you pegang air dia. And then, if you want to use injection, don't inject into the muscle that have lost their mass. Pergi yang ada isi sikit lah, cucuk kat situ. So normally we don't cucuk at the deltoid. We cucuk yang ada isi, which is dekat sisi punggung. Sisi punggung bahagian atas. Okay, ventrogluteal sign. And then when the patient is online, other line, you need to monitor closely the intravenous infusion to prevent fluid overload, especially if patient got respiratory distress. Maksud kenapa dia ada respiratory distress? Banyak air dah berkumpul di dalam paru-paru. So patient tak dapat bernafas. So that can be cause of overload of fluid. Fluid overload. Dan lain-lain tanda is edema. Edema is swelling. Either the hand is swelling or the foot is swelling. Extended neck bends, it's neck bends dekat sini. Kalau dia extended baru nampak. Kalau kita normal kita tak nampak. Dia punya urat dekat leher ni pandai timbul. That is extended neck bends. Fluid overload juga. And full bounding pulse. Bounding pulse ni macam yang bunyi dedup yang kuat. Full bounding pulse. Pulse. Okay, pulse. So you can actually try to Google what is bounding pulse and listen to the sound of that bounding pulse. Okay, so we need to teach also older people about medication. Okay, especially those who have problem with hearing or with the vision, then offer glasses. Okay, cermin mata and also hearing aids if needed. Then bila kita mengajar, make sure the lighting is actually adequate dan kurangkan gangguan di sekeliling bila kita mengajar. Kalau boleh dalam bilik yang senyap, terang, okay? And then when you speak clearly and slowly. with low pitch voice. Okay, low pitch voice. Okay, contoh saya panggil Pakcik Rakib. Okay, Pakcik Rakib. Ini ubat ya, ubat darah tinggi. Okay, namanya atenolol. Atenolol. Cuba ikut. Atenolol. Cute Pakcik Rakib. Okay. Ubat ni kena makan 1 kali 1 hari. Cakap macam tu. Pagi saja. Bangun pagi, makan ubat. Pun boleh macam tu. Okay, right? Alright, and then you need to face the client when speaking. Dia kena tengok awak kena tengok dia. Jangan pula mata awak ke bawah dan tunjuk. Patient pun tengok lain-lain. Okay, so you have to speak clearly and slowly with low pitch diet. Low pitch voice. Okay, jangan pakai tinggi. Pakcik! Itu pitch, high pitch voice. Makan ubat 1 kali 1 hari. Tak boleh lah. Okay, alright. Nanti satu word tu dah boleh dengar kau cakap macam tu. Okay. And then sama macam orang muda, your teaching session 15 to 20 minutes. Sebab more than that, they will lose their focus. Alright. And then give sufficient time for review, question and client demonstration. So kalau client perlu pakai jarum, minta dia orang tunjukkan macam mana pakai jarum tersebut. Macam insulin pen. Your friend will actually explain on that later on. And then if patient can read, boleh membaca, kita sediakan visual aids and reading materials that are colourful. Okay, awak pun suka colour-colour kan? Colour-colour you nak baca. Kalau dia hitam putih tak nak baca. And make sure it have a large print. Font besar. And then you relate the administration time for medication to the person's daily schedule. Macam tadi, bangun pagi, makan breakfast, makan ubat. Tengah hari makan lunch, okay, makan ubat. Lepas tu petang, makan malam, makan ubat. So you can actually relate that supaya patient ingat setiap kali makan kena makan ubat. So you actually make them a practice and also a routine so that they can actually remember when to take it each time of their meal. And last but not least here, avoid treating the elderly like a child. Okay. Kalau boleh, tadi salah lah madam. Janganlah bawa penyanyi. Bangun pagi, gosok gigi, cuci muka, makan pagi. Makan ubat lah macam tu. So, tell them, treat them with respect and then bila kita mengajar dia ikut umur dia lah. Okay, right? This one, tell them not to share medication with anyone else and always inform healthcare providers about the medication. Kalau habis, call ataupun pergi ke klinik ambil lagi ubat. And then, if possible, bila dalam sesi mengajar, include the family members. Kalau tak ada family members, kawan dia ke, neighbor dia ke, jiran sebelah ke, about it. So that kalau family members tak ada di rumah, at least jiran boleh ingatkan atau kawan dia boleh call. Okay. And then tell them not to take more or less than prescribed. Terus mesti ikut cun-cun. And last but not least, do not take expired medication. Yang expired, you akan nampak expired ataupun dah bertukar colour. Okay. Dia putih tapi ada bintik-bintik hitam, bagi tahu makcik jangan ambil. Let's say tak nampak, minta tolong jiran atau family members to see and check whether the medication can still be taken or not. Alright. So that's it. Very straightforward. Very straightforward. Okay. Right. Any questions from you? Any question? Kan Rakib cakap. Any question from you? Okay. Any questions from the floor? Right. Just nice. I take only 10 minutes lebih. Okay. Any questions? So you will see that pediatric and older people, they have some similarities in terms of their physiology of taking a medication. Okay, the absorption, distribution, metabolism, and excretion. As for young, very young pediatric, it's because of the immaturity. Tetapi bila on the other hand, okay, when they are too old, it's because it's already cannot be used as good as when they are young. Okay, all right. Okay, thank you very much. If it is clear, okay. If no question, please sign in your attendance at the usual place, Google Classroom, and you are 154. Sign in your attendance and you are 154. And then I already put up the topics for you to study for your annual 154 test. And those groups, please get ready for presentation this Thursday. The platform, I will let you know. Either we can do face to face or we can do just like before we do for the BHS as well. I think that is also very clear. It is actually very easy also to conduct. Okay, so with that, remember to please sign in your attendance for today. Thank you very much for tuning in. Thank you very much for listening. I hope it is clear. I left with one more topic, which is the medication error that I will do at the end later on. So that stay safe, everyone. Stay healthy, and thank you very much. Okay, and I'll see you in the next session. Bye bye. Bye bye. Bye bye.